All right, welcome everybody to our Lunch and Learn Speaker Series with the Down Syndrome Center of Western Pennsylvania. This is the second in our series. Last time we had Dr. Velody, and today we will have Dr. McCormick, who will talk about transitional care in Down syndrome. Dr. McCormick directs the Healthy Transitions program of the Down Syndrome Center of Western PA, and today he'll describe the program and his holistic and longitudinal approach to supporting and preparing young adults and their families on their journey into adulthood. So welcome, Dr. McCormick. Thank you for presenting today.
Absolutely. And thank you all for joining. And I'll just start by saying that, a really huge thank you to DSAP because, we wouldn't have the Healthy Transitions program without DSAP. Many, many moons ago when we started the transition program, now in our 10th year, DSAP was one of our initial generous donors who allowed us to basically have more time and more space to work with families around transition, which is really, really important. So just to start to say, it's kind of nice to be able to do a lunch and learn with DSAP because you guys were the ones that made this possible. And, one of the things when I think about transition, you can see on my screen right now is a pretty famous bridge in Pittsburgh. It's one of the three sister bridges. If you're kind of familiar with downtown Pittsburgh, and this is the Roberto Clemente Bridge, the one that you would cross as you go to a Pirates game or sporting events from downtown to the north side. And I think this is important because when we think about bridges, we think that's what I imagine around transition. How do we create a solid and firm pathway to move from pediatric-oriented to adult-oriented care? And we know that the reality is that there's different cultures, different expectations, and there's just relationship that has been built that changes as you move into the adult world. And so it feels like you're going over a chasm or you're crossing a river. And so having a well-built bridge is really, really important. And so when we think about transition, I think about bridging transition. How do we build that bridge well? So that's what we're going to be talking about today. And specifically, I give this talk to lots of different places and lots of different people, but this is unique for me because I'm giving it to the community that I work in. And so often I'm talking to families about, hey, how can you advocate? How can you help your provider develop a transition journey that is good for your young adult, yourself, and the provider together? But today I'm going to be describing what is the transition program that we have available to all the members of our community. So I'm going to be talking a little bit about what is our why. Why do we think that transition is important? And I think part of the why, right, would be that you as parents, as young adults, can feel in your bones the importance of that support. This is a big change and you need that support. But I want to go for a little bit of a deeper why that we're going to talk about. Then we're going to talk about what are the pitfalls around transition, how can things break down during this time period, and then really we're going to talk about how do we create this toolkit. What is this Healthy Transitions program? What are the pieces around that help us make sure that these pitfalls are solidified, that we have a good, well-built bridge? So first, thinking about our why is this idea of a model of value. And I always like to start by naming the fact that we as a healthcare community, unfortunately, have the wrong paradigm on a lot of things. And, we're trained and we often work from what we call a disease model, meaning that when we see differences, we see things that need to be corrected or changed. And often we even view this idea of disability, right, as disease. Like, what are the things that need to be fixed in an individual who comes with differences? But I would say at the heart of why transition is important and why we created this program is really that we need to shift this picture, right? And you guys would all agree with this. When we think about people first language and we think about highlighting the strengths and values of our young adults in our community, is that we really view disability as diversity, right? Those things that are different are the things that actually give value, right? They're the kind of if we're making a fabric or making a quilt, those are the beautiful threads that are written across that fabric that kind of give kind of the zest or the beauty to that fabric. And, when we think about this idea of, young adults moving into adulthood, we think about, hey, How do we let them be their full self in adulthood so that we can really value that diversity? And just to kind of highlight this even further, I love telling, showing this image when I do this talk, and you guys can all see this is a cell phone. I know that even right now we're texting people about if they'd like to join this meeting, and we're recording this. But the truth of the matter, right, is that, when we have cell phones, I can even see right now, my wife is texting me, that we communicate often through text messaging, well more than we do with calling, right? It's just so easy, and it makes it simple that instead of having to do a phone call and stop in the middle of the thing, you can send a quick message. But I just want us to highlight that text messaging was not created for that purpose. Text messaging was created for people who have hearing impairment, right? It was a technology that was used because we had to have cellular communication in a way to communicate, even if you had the inability to hear. And so the beauty of this is that when we hear that story, we realize that while this technology was made for those people, it's a technology that has added value for all of us. And this is really this idea that, once we start thinking about the diversity of all of us, when we think about this idea of centering on the margins, thinking about the people who experience the world differently, if we can kind of view and support and kind of focus on what they need, it actually benefits all of us. And so you may be like, well, I 100% agree with you, Dr. McCormick, but what does this have to do with transition? And it really gets to this idea that for our young adults who have differences, to be able to really share those things that are so valuable about who they are, we want them to traverse the adult world in a full and complete way. And so transition, the system that we have to help support our adults, is about inclusion. It's about, we know that as they get older, they will be adults. Just by definition, based on their age, they will become an adult. But we not only want them present, but we want them valued. We want the diversity of who they are to add. And so transition is really about this idea of value and about inclusion. How do we help our young adults bring their full self into adulthood? And that really gets to this point of what are our pitfalls around transition. And I really think of three really big pitfalls we have to think about. It's about the timing of transition, right? When we think of transition, people kind of get confused in their mind about transition and transfer. Transfer, right, is the physical movement from pediatric care to adult care. From an educational perspective, it's the movement from graduating your educational into employment. It's that movement from one place to the other. We're not talking about that. We're talking about transition, which is the purposeful and planned movement from one place to the next. So it's not that moment of change. It's everything that leads up to that change to prepare you so that change can be done well. And the problem is we often have a transfer leap, meaning no one's really discussing this until it's 18, 19, 21, 26. And, your adult provider's like, oh, you're like, well, I want to set up my next appointment. And they say, well, your next appointment was going to be with the adult provider. And you're like, what? And no one's prepared you, right? We have this transfer leap. And even when we do have people who have started developing this purposeful and planned movement, it often feels more like this, right? A rope bridge where people have just kind of put some slats together and hopefully you can make it across the river. But what we really want to have is this image of a bridge, right? And the bridge is not just the metal that spans that chasm, but there's an on-ramp, there's a process in which we prepare, and that's a huge part of it. And then there's the crossing, right? But there's also an off-ramp so that once we get to the adult world, there's a way of having guardrails on the other side to make sure that if everything doesn't go as planned, there's a way to support you through that process. And we're going to really talk about these 6 core steps: discovery, tracking, preparing, planning, transferring, completing, as the way in which we do this, right? And so when I say discovery, what I mean is when we think about transition, it starts from the moment your child is born. You may have not thought about it, but you're holding your child in your arms and you're thinking about what their future will be like. And you're saying, I want my child to be loved. I want my child to be in healthy relationships. I want them to have work that gives them purpose, right? So discovery is about thinking about the end point. I think about transition as a journey. meaning wherever we're going, we have to have an idea of the destination before we leave, right? No one's like, I'm going on vacation, gets in the car and starts driving and said, okay, where are we going? They say, okay, we are going to go to Florida. So I'm going to plan my stops and my trip along the way. So you have to start with this idea of discovery, thinking about your destination. What is that future you want for your young adult? Then we think about tracking. Tracking is like when you go, well, when we used to go to AAA, right? And you got your roadmap and they would give you like all those different marks along that journey about like, where's the gas stations? Where are the tolls? Tracking is like, we all know different things that need to happen across that way on that journey. There's this checklist across the process. And so we have to track it. And then preparing and planning is this recognition that everybody's journey is different. And so some people drive real fast, some people have to drive a little slow. And preparing and planning is taking that young adult into mind and say, where are they developmentally? Where are they in their readiness to take on these skills of independence? And then as we assess that, how do we just nudge them along? How do we help direct them in that pathway? And that all happens so we can move to transfer, right? We can actually take that step and move to the adult world. And completing, like I said, it's the guardrails on the other side. You know, just because you're in the adult world doesn't mean that you may not need a little bit of support to make sure that you're able to be there successfully. So the first kind of challenge we have is timing of transition, and that we need to move away from this idea of the transfer leap and move into this idea of a purposeful and planned process where transition happens over time in a progressive manner. And the second challenge around transition is this idea of silos of care. You know, when I started doing the transition clinic and I started having discussions with families, one of the things that became apparent to me is that while I might be able to support them in a lot of healthcare needs, they also wanted to have lots of discussions about all the other stuff that's going in our life. Because the reality is everybody just thinks about their lane, right? The school is saying, hey, what do we need to think about when you're going to graduate and what does employment look like, or how are you going to do self-care skills, right? They're focusing on that lane. The doctors are like, how are we going to make sure you're taking your meds? And how are you going to feel comfortable with your care? And how are we getting you to those adult providers? Probably not many people are talking about what's happening legally and financially, right? That there's these kind of road marks at 18 that all of a sudden change who's the decision maker or what happens financially from Social Security or waivers or those kind of things. And then there's community, right? Is someone thinking about what happens when I graduate from high school? I've been there for 21 years and all my social network and my kind of structure in life has disappeared. It's evaporated. And now I'm trying to put this together. So people are all just thinking about their lane, but we need to think about this more holistically, right? You know, if transition needs to be longitudinal, right, building that bridge, it also needs to be holistic. I think of this more as the domains of transition are pieces of a puzzle. Each of these pieces touch each other. That means how they're working impacts the other piece. And if one of the pieces is missing, the whole puzzle is incomplete. So if I, as a healthcare provider, you know, don't do a good job making sure that you have a good landing spot and have made that transition well and feel comfortable in your health, if you move to the adult world and everything falls apart, then that impacts your ability to work, right? It impacts your community, how you can socially interact. It impacts, you know, financials. All of these things are integrated. So we have to think about transition holistically. And then the last thing I think about, if we think about transfer occurring kind of timing wise too late, if we think about it being in silos, it's not being holistic. The last thing I think about is the transfer tug of war, meaning transition is got a lot of stakeholders involved. It's got mom and dad, it's got a young adult, it's got healthcare providers. Let's just be honest. It's got the school involved, it's got legal services involved, and everybody is kind of pulling at what this transition should look like. You know, your young adult is pulling for independence. The parents are like, oh my goodness, I don't want them to make a bad choice. I don't want them to fail. And then the school and the healthcare system is like, we need to help you move along because we have to do something to help you get to this next step, right? And everybody's vying and pulling. What I want us to think about is instead of transition being a tug of war, recognize that transition is what I call a dance. Meaning, you know, when my girls, I have three girls, my oldest is 16, my youngest is 10. when they were really little, we used to have dance parties all the time, and they thought for sure I was the best dancer in the world. They have come to realize that they are much better dancers as we've gotten older. And part of that, right, is early on, they look at you, right, and they're dependent upon you and they want to connect with you. And so it's the same thing in healthcare, right? You're the caretaker. But as they get older, you want them to blossom. You want them to fly. You want them to kind of take that independence. But it's really hard. This is developmentally normal that they want independence. And it's developmentally normal as parents that we don't want to let go. But we have to be conscious of this. And we have to think about it as a dance, that you initially are dancing and leading for your child. But eventually, that child's going to take the lead and may even go and dance on their own. And we have to think about that consciously. So when we think about transition, we have to think about it being longitudinal, holistic, and developmentally pushing towards the level of independence that your young adult can best attain. So the question is, how do we do this? And we talked about these different steps of discovery, tracking, preparing, planning, transferring, and completing. But it's more than just a philosophy or an idea, right? We need to put some meat on the bones, and we need to think about how do we operationalize these different steps so that we can functionally do that. And that is what we do in our Healthy Transitions program. And so I just want to walk us through each of these core steps, talk a little bit about what we do in our Healthy Transitions program, how that specifically is there to support you, and just give you some insight about what we're kind of doing. And of course, at the end, I invite you to join us. I know some of us probably already see me in transition visits, but I'm also happy to have anybody else who's new here. So the first one we're going to talk about is that discovery phase, right? You got to think about your destination, right? So part of that is dreaming for your young adult. We all dream for our kids to have some level of independence, to have worth in the work that they do, to have healthy community around them, to have healthy relationships. But we also have to dig a little bit deeper, right? As they get older, we're going to refine that process. And so what you guys are doing today is part of that, right? Coming to this talk and learning about what is healthy transitions, what are the steps? It's creating that foundation, right? We need to have some educational foundation around what does a good transition look like? What are the things that need to be on my radar screen? What do I know well? And what do I need to dig a little bit deeper in? And like I said, it needs to be holistic. So just so you know, every year at Children's, we have a transition conference where you guys will all be invited to come and spend a Saturday with us, where we are able to kind of deep dive on some of these topics, talk about future planning, or about legal services, not just healthcare. But also there's some online resources, so you don't have to wait for those things. So Got Transitions is a great website. It's a website that is made by the National Institute of Health, that is a reservoir meant to give resources to parents, providers, and young adults around transition. And so I encourage you to look there. And if there's a topic that you're specifically interested in, legal, financial, healthcare, go look it up, read about it. There's also great resources. I have one of our resources on there, which is the Down Syndrome Transition Guide, which is actually out of print. We have some of them that we give out to our families as you come to our center. But unfortunately, because the publisher is no longer, that this book is currently out of print. But there's other resources that aren't necessarily specific to our community. Another great one is your Complete Guide to Transition Planning and Services, which is another great resource if you want to deep dive a little bit more. After that idea of the discovery, right? So that's the part where you're just getting your foundation and learning the basics. You then need to say, how do we individualize it to your young adult? And that's really where our transition visits come in. So our Healthy Transition program not only has educational foundation, but we individualize it to you guys. And this is where we do the tracking, preparing, planning, and transferring piece of the puzzle. And a transition visit with us is, it says build your team, because I'm often talking to parents across the country and telling them how they can build the team. Well, I want to invite you to our team, which is our Healthy Transitions program. We spend 2 hours with our families during these transition visits. And the first thing that we do is we talk about something really, really boring, which is our transition policy statement. Now, this is important because the idea is that we need to create a contract together. And our policy statement isn't like, you're going to be leaving Children's Hospital at this year. No, it's a way for us to talk and say, hey, we know that your young adult is getting older and they are going to eventually need to move to the adult world. hey, how can we partner together? We would love to start seeing your young adult at 12 years of age, at 14 years of age, and start having this dialogue on a yearly basis so that it can be this longitudinal process. And what we're going to do is we're going to come together and agree that based on how your kid is progressing through that journey, decide when that movement to the adult world is. Sure, our goal is 21 years of age, but we're going to work with each other as we go through that process. Also, the other thing we want to do is we want to be able to start teaching your young adult how to have medical conversations, right? So early on, you're going to see that I'm going to turn to your young adult and start asking them questions at 12 and see, what questions they have, try to bring them into the conversation. We're going to want to have conversations with them by themselves, mostly so that we can teach them when they're in the adult world, they're going to have to learn those self-advocacy skills. So why not have a better place than in a pediatric hospital with a long-term relationship with a provider they know that they can develop those skills of independence. So our transition visits are kind of where the work is done. And let's talk about these kind of really important steps. So the first one is what we call our transition checklist. Our transition checklist, like I said, if you're on that journey, it's those mile markers. The other image I have in my head is whenever you guys jump on an airplane, right? The worst thing in the world is you're on that kind of takeoff pad and they're like, I'm so sorry. We're delayed because the bathroom water isn't working, right? And you're like, well, what does the bathroom water have to do with us getting on this plane and flying? But the reality is there's like a huge checklist that pilot is going through to make sure that plane works 100%. Because the last thing you want to do is be at like 10,000 feet and say, uh-oh, our landing gear doesn't work, right? So you go through that checklist. Transition's the same way. You don't want to be in the transition process and be like, uh-oh, no one told me to do this thing, and now I don't have landing gear. So our checklist is making sure we're in that process with you. And that's really this kind of way in which we track the process. And this is kind of just a quick summary. So this is the old school. We used to have paper copies. Now this is electronically in the EMR. But this is what we do. We make sure that what we say we're doing, that we're tracking that we're doing it, right? So we talk about the policy statement. Did we discuss it? We're going to talk in a few minutes about readiness assessment and goal development. So we're going to assess, is your young adult developing, getting those skills for independence? And if not, what are the goals that we can work towards it? Are we doing a medical summary? Really, really important document we'll talk about in a little bit, but it's like, how do you summarize 18 years of medical chart into a single page that an adult provider, when you meet them for the first time, can actually have a real discussion with you because they know what the key problems are and what's been going on. And then the other ones are these other pieces, like we have to think holistically, right? We know that at 18, the US government views you, your young adult, as an independent decision maker. So we need to have a conversation with you when they're 12, 14, 16 to understand, as a family, how are you going to navigate that process? The discussion shouldn't happen at 17 and 11 months. Because the reality is that makes it really challenging to think clearly about what's best, right? How can we give that young adult the least restrictive, but the most supportive model of medical decision-making at that point? And then we also have to check in with you. It shouldn't be just like, 21 years of age, you need to go move to the adult world, period. No, it should be, hey, at 12, we're going to say 21 years of age. At 14, we're going to say we're shooting for the summer of our 21st birthday. At 18, we're like, okay, we are going to be shooting for August of our 21st birthday so that we can see you one time before we're making that movement over, where we're refining it down. And during that process, if you look, it says select an adult provider. We're having a discussion with you. Say, hey, you see endocrine, cardiology, you see us, you see a primary care doctor. What's the best order we want to do this? Do you want to go meet all your subspecialists first? And then we can decide when we're going to transition and who. And it needs to be a conversation. There was this great article that asked parents, what is the most scary thing around transition? And high on that list was, my pediatric provider doesn't help me in the process of knowing who to go to. We need to have those discussions. And so that's part of our process. And our transfer of care is really our completing phase. It's the kind of, our checklist doesn't end until we're actually moved to the adult world and we've proven that we've done the things we need to do. So, every time you come to visit us, every single visit, we're looking at that checklist and we're making sure we're doing those steps. And every time you're going to at least be hitting the steps of doing readiness assessments and working on that portable medical summary, because those are kind of these key components to think about how do we make sure we're ready. And that one we said about was our readiness assessment. So what that is really this preparing and planning phase. It's this idea that we say, is your young adult got the developmental skills they need to be independent? And so it's this dance, right? It's this back and forth. Prepare, we're checking to see if you have those skills. Planning, making goals to move you along. Prepare, you come back a year later, seeing where we're at, have we been successful gaining some goals? What are our new goals? And it's a dance to make sure we're moving along the way. So the specific tool that we use is something called TRACS. It's the Transition Readiness Assessment Questionnaire. And it's really this questionnaire that looks at skills around independence that are important for self-care, taking care of yourself from a healthcare perspective. So it talks about medication management, managing appointments, tracking my health concerns, talking with providers, as well as some things around activities of daily living, the things I can do to take care of myself. And the idea with this is in this survey, we ask you, and usually it's Denise, our nurse, who's asking you before you see me and saying, hey, let me know, which skills are you like, I don't do this, we haven't thought about it, all the way up to, yes, I do this and I do it every time on my own. And the idea is when we fill this out during our visit, I'll say, hey, let's look at our readiness assessment. Let's see, what are some of these domains? What are some of these areas that we can kind of work on, right? And I always say, hey, everybody in this room is really, really important. The transition of this young adult is important to the young adult, it's important to the parents, and it's important to me. So we are all going to come up with one goal that we are going to together decide is an important goal to make sure that transition is successful. So then an example of that would be if we had this form that's filled out for us and we created goals of, hey, I want to learn to take my medication independently. I want to make a list of questions to ask my doctor every time I come in. Hey, I want to learn to keep a calendar. But one thing that's really, really important is after we make these goals, right? These goals are great. We moved from very like obscure, hey, what are some skills you have, to kind of saying, hey, these are the specific skills I'm going to focus on with a goal. But we even need to refine them more, and we really need to operationalize them. And that's what we're going to do. So an example of this is if you said, I want to learn to take my medication independently, we might be like, that is a great goal. What are we doing right now? And you might be like, oh, my young adult is on Synthroid for hypothyroidism. And every morning at breakfast, I go to the pill drawer, I take out the bottle, I give them one tablet, and they take it. And that's what we do. And we say, okay, great. That is our starting place. What is one step we can do to move towards independence? It may be just buying a pill tray and every Sunday saying, we are going to sit together, we're going to fill in this pill tray, and then every morning, I'm going to have you take your pill tray and take your medicine. So there's this shoulder to shoulder, right? Learning that skill. And it's beautiful because when you're filling that pill tray, you can also have these conversations, say, hey, I see we're putting these pills in. Do you know what you're taking these for? Oh, what would happen if you took too many of these pills? What would you do? Or, hey, what if you all of a sudden took a pill and you felt bad? What would you do? You can have these conversations with your young adult, seeing how are they doing with these skills of independence? What support do they do? And also you now build a system that they can add on to, because at some point they're going to get independent and they're going to be able to fill their pill tray on their own, take it every day on their own. And then guess what? They're going to know a week in advance when their medication runs out. And you can say, hey, what do we do then? How do we learn to refill our medication? Or, hey, you went to the doctor and they said you have a sinus infection. You now need to have amoxicillin every day. What do we do about that? And they can say, oh, I just put that in my pill tray too, and I can take that medication. So it's something, it's that way of small steps that build to learn that independence. And the other thing that we have as a resource, we created this with CMU, is this Teen Guide to Medical Transition. And it's this great workbook. And I can actually share this with our friends at DSAP, and they can send it out. It's a PDF, so we have all copyrights to it. And you guys can print it off. You can go to Kinko's, you can go to Staples, and you can have them bind it, whatever you want to do. But it's a great workbook that you can go through, and it has some sections that talk about, like, what are my values and goals? Oh, what do I think about sexuality and my identity? It also has sections on, hey, healthcare. And it goes actually through, it uses TRACS as the model of what are the skills we need to learn. And it allows you to have these conversations. So if your skills about talking to your doctor, It gives you examples of like, what are some questions we could ask the doctor? And you can do some role playing with your young adult. Or maybe it's about your young adult needs to work on taking appointments. Okay, our goal is that they're going to learn how they can call the doctor's office, ask for an appointment, make an appointment. Once again, it gives you some dialogue of what are the things you need to have, how do you prepare for that? And you can, once again, shoulder to shoulder, practice having a dialogue with them, teaching them these skills as they go along. And like I said, even about medicine, like these are some great questions. As I'm taking my medicine, what are some questions we can talk about as a family so we can make sure that we're not just learning a skill, but we're learning about that medication. Okay, so we're understanding a little bit about this transition visit, how we use these checklists to make sure that we're doing all the right steps. Just so you know, we also have what we call our holistic transition checklist. So that transition checklist you saw really focused on healthcare. We have a separate one that we will talk with families about, that talk about what's going on in school, what's going on financially, what's going on legally, what's going on with community, because we want to not take over that, but we want to make sure that we're having a dialogue of saying, well, what's happening? And if you need more resources, how do you do that? So if a family needs legal support, we've had relationships with Pitt Law, and they've given us some brief counseling for our families to say, what's that support? We work with Achieva, right? And they're awesome at saying, hey, if a family needs financial or legal support, we can connect them to people we trust and know who've done this. And so it's a great way for us assessing and then making sure you have the right connection to those resources. The next piece, though, is what I call our transfer gear. So our transfer gear is like, if you're going on that journey, these are the bags you got to have packed, right? And that transfer gear, one of the most important ones is what I call our portable medical summary. So there's other transfer gear that is less medical direct, but this is kind of the transfer gear that I'm really responsible for. This is a one-page summary that allows us, so that means me as a doctor, you as a young adult, and as your parents, to come together and create a one-page summary that allows a new provider to know what are the most important things about you. So you can see, and I broke this up into different slides so you can look a little easier. At the top of it, it has like key information, like what's your insurance? Who's your power of attorney, or who's your guardian, so that the new healthcare system has a quick resource of who should be in the circle of discussion, who makes decisions in the family. But in the second, at the very bottom there, you see 4 really important questions to me. Because when that young adult meets that adult provider for the first time, I want them to have a clear understanding of what are the strengths of that young adult. And so there's these questions about activities of daily living, pain, communication, and preferences. So by activities of daily living, I mean, what are those independent skills, right? We want that adult provider to know what level of independence our young adult has. Are they dressing independently? Do they bathe independently? Are they using the toilet independently? Feeding, their hygiene skills? Do they need some support in any of those things? Hey, normal is what is normal for you and your family, and we're going to help push you towards independence. But, everybody has different levels here, and it's good to share what skills your young adult has so that adult provider knows. The second one is pain, right? We know that our young adults experience pain just like everybody else. They sometimes express it differently. And you as a parent are an expert in that piece, right? You know that your young adult, when they're in pain, they get quiet, right? They're usually pretty jabbery, vocal, they're ready to share with you, but they get kind of quiet and reserved when they're in pain. Or they have some other thing. Maybe your young adult will kind of maybe physically show you, they'll be pulling on their shirt, or they'll be limping or something like that. And they have those physical, but you might be like, are you in pain? And they'll be like, no. It's important that an adult provider knows what pain means like for your young adult. Communication, right? Once again, our young adults have communication skills across the spectrum. Often we see that receptive language, what they're understanding, outpaces expressive. And sometimes expressive is more a matter of pacing, right? So we have lots of young adults who have lots of words, they have great communication skills, but when they're in a new setting and they're nervous, they talk really quickly, and then the words are harder to understand. And you know all these things, right? You know what is the best way for your young adult to communicate. So you can share, hey, if I'm nervous, just ask me to slow down and repeat. And that really is helpful for me. It's going to be different for each of your young adults, but let them share what is the best way to communicate. Because the last thing you want to do is an adult provider be like, I I can't understand this adult, and I'm going to turn to mom and dad and ask all my questions there. No, we want that young adult to be engaged in that process. So we want to equip as best possible. And the last one is preferences, right? I know for sure when I have a conversation with a young adult, if I know that one thing that they love to talk about, that's the one thing I want to start a conversation with, because we can create some great quick relationship, and using those preferences are really important for me to be able to make that connection. So those are kind of what I think of those really individualized. Who is your young adult as a person, so that adult provider can really get a quick jump start and having good communication with them. The next set is kind of our list of what we call our kind of areas of challenge, right? So these are all the healthcare challenges. So like if you thought from like a endocrine perspective or hormone perspective, maybe your young adult has type 1 diabetes. This is where you try the provider, so myself, summarizes your young adult's healthcare journey, right? So I'm going to say things like they were diagnosed with type 1 diabetes when they were this age. This is their current treatment management. This is what their last labs that showed how well controlled they were. These are the last time they were seen. That way an adult provider can like have all that key information right there. They don't have to go through 100 pages of chart to figure out where they're starting. If we can summarize that, that's really, really important. And then on top of that, we layer with a list of medications, equipment. So lots of our young adults are on CPAP or BiPAP for sleep apnea, right? They need to know what machine, what mask they have, what are the settings, so that as they take over and maybe help order that, they know exactly what to do. They need to know about immunization history, they need to know family history. This is a way of summarizing everything really quickly so an adult provider can jumpstart that first conversation. The last portion, though, is also really important, and it kind of does something a little bit different. It's a list of providers, and it's a list of their pediatric providers. This is that, those guardrails. It's the talk back, right? So if I'm the new primary care provider who is taking care of your child for the first time, I've got this great understanding of that they have type 1 diabetes and maybe they have hypothyroidism. But you know what? I understand where we're at, but things are a little bit confusing to me. Who is their endocrinologist? And I can have that listed there, and I can know exactly who to contact back so that there's not this gap. It's not like, well, I don't know who they are. There's no way I can get this information. I just got to start from ground zero, right? But it's not only the doctors, it's who their pharmacy is, their DME company, right? Yep, they've been having these chickmunk inserts for their whole life, and they've been going through the same DME company, and now I have to be able to send the script to them. And it'd be great if I knew who that was. It could also be community supports, right? Who is the most important supports outside the healthcare system that we can collaborate with to make things successful? So really, that portable medical summary is a great way of helping jumpstart that relationship so they know your young adult as a person, but also can really get a great glimpse at their healthcare story without having to kind of decipher a huge chart. And then there's these other pieces of transfer gear, right? There are other clothes you've packed into your bag for that journey. Your official kind of legal decision-making paper, your living will, your resume. This is, side note, we're not talking about these other ones, but I would say, if you want your child to be really, really successful, making that leap from school to work, right? It's a really horrible statistic, but the statistic is that individuals with intellectual disabilities, 80% of people graduate to unemployment. They graduate to the couch. We want to change that scenario for our young adults. And so it's about building that resume when they're 12 years old, right? When they're 14 years old. You start by having them volunteer, right? And you do shoulder to shoulder volunteering. I love taking care of animals. Let's go volunteer together at the Humane Society and see if you really do love taking care of animals, or if this is just something that's interesting to you. And you start doing it every Saturday. Write it on your resume, or else you're going to forget about it. Right? Who was your contact there? Do you have someone who said, oh, this young adult did a really great job when they were 14 with their parent? They were dependable, they showed up, and they can be that kind of, as they get older and they're asking for somebody who will support this person, who's going to be that contact to say they did a good job. So start building your resume early, all that financial documentation, as well as some of the kind of official legal documentation, state IDs, birth certificates. Just real quick for state ID, moment your child turns 16, even though they may not be driving or getting their learner's permit right away, go get their state ID. The reason why is that it's great to have that official documentation. So when you're going for a job, you have that, right? Because the problem is when they turn 18, before at 16 to 18, you can go with them into the DMV, walk them through that process. It just becomes more challenging as they get older. So get them that state ID. They'll love it too. They'll be like, here's my ID, just like my friends who are getting driver's license. It gives them that sense of worth and responsibility, but it's also really, really valuable. Okay. So the last thing we'll talk about is our graduation packet. So we've had these transition visits. We're doing all this transition stuff, but you know what? At some point, they're going to move to the adult world. And when they do, that is something we have to celebrate. So it's a graduation. It's something that's super, super valuable, and we have to highlight it. When I think about a transition graduation packet, I think about a warm handoff. Really easy for me, right? I call Peter Bulova up and talk to him. I send him a message and say, hey, I have this young adult who's coming to see you. And I always say Peter is like a pediatrician in the adult world. He is the most warm and fuzzy handoff place you can have. So it's great for our community, but we have to have a physical conversation, be it, calling him on the phone, sending him a message. We have our transition checklist. Make sure one last time we've done everything. Make sure we have that updated portable medical summary. Have our adult guidelines. So you guys won't have this problem because Dr. Bulova, Peter, he actually was the one that wrote the guidelines. So he knows them very well. But you might be like, well, Peter's in Pittsburgh, and I can't see him every single year or see him for every visit. So maybe you go to your family practice doctor, which is great. One question parents always ask me is like, well, who should be the next primary care provider? I say, who do you go see as a doctor? The truth is, adult providers actually are pretty good at taking care of complexity. They're used to people having health problems. They just sometimes get a little bit fuzzy about like, hey, I haven't taken care of a lot of people with Down syndrome. The beauty is the guidelines tell them what are the things they should be thinking about. They know the medical side of things. They just need to know what is the context, what are the things they have to think about. And then, of course, we're always that talk back. If there's ever any problems, we always love having conversations to support our new adult providers as they take care of our young adults. So we're going to have a little bit of time at the end for questions here, but I just want to remind us, hey, transition, it needs to be longitudinal. We want to see you guys early and often so we can be talking about this and supporting you through this journey. It needs to be holistic. We want to talk about, we're not doing everything. We're focusing on healthcare, but we know that it touches everything. So we want to have conversations and we want to support you. And it's a dance, right? We do need to support our young adults to have as much independence as they developmentally are ready for, right? And so I always like to end with this quote by Fred Rogers, right? We all love Fred Rogers, being Pittsburghers. And it really gets to this idea of a dance, right? So transitions are almost always signs of growth, but they can bring feelings of loss. To get somewhere new, we may have to leave somewhere else behind. And that hits us as parents, right? That's the part that's hard. We love our kids. We want them to be successful. And that world seems scary, but we have to give them graded independence. And we're going to have to let them have a little bit of good trouble, right? We have to let them be able to learn how to be independent in a safe way. And so recognize that idea that there is going to be a possibility of having some feelings of loss, and that's normal. It's developmentally normal for our young adults to have independence. It's developmentally normal for us to feel those feelings as well. So I just want to thank you guys all, and I encourage you to join us on our journey towards transition. And I will stop talking there. And then if people have any questions for me, I'm more than happy to answer them. And I'm going to stop sharing so we can have a screen I can see everybody's faces.
Thank you so much, Dr. McCormick. I really appreciate your presentation. That was really informative. And we'll have the recording, like I had mentioned, and we'll have that resource as well that you had mentioned too. So we can certainly send that out and share that with everyone.